Hey, so let's talk about natural, non-pharmaceutical ways of treating depression and anxiety, and potentially insomnia, maybe some other. So there's a machine called ExoMind, ExoMind. This is a modality that is fairly recent. It is transcranial magnetic stimulation. I know that's a mouthful. Transcranial magnetic stimulation. So there are other devices out there, but they tend to be uncomfortable. They tend to also be rather cumbersome, meaning you're like strapped in. You know, your head is fixed where you can't really move. You're sitting up and you're rigid. When you've got this device, these other devices towards your head, even the sensation that you're feeling may be quite uncomfortable. Whereas with ExoMind, what's interesting is it treats a very specific area of the brain, and this area is mapped, so you know exactly where to place the device. The other thing that's really nice about this is it's only 20 minutes. So 20-minute session, and then within 6 sessions, that is a complete treatment period. And after that, you can do maintenance. And some people may need maintenance once a month, once every other month. It really just depends on what your situation is. And what I'm excited about is there's a lot of folks like you and me who really aren't into pharmaceuticals unless you absolutely have to have it. And I just did a podcast. We were talking about this, and it's funny, but it's not funny if you're the person that's going through this, in that when you have to try these antidepressants, you literally go on a trial of antidepressants. So what that means is you're going to try something for several weeks to a month, maybe more, to see if it works for you. And the thing is it may not work for you. It might not help your depression. It might not help your depression, anxiety, but you can still get the side effects. You can still get the acne. You can still get the insomnia. You can still get the weight gain. So just because it doesn't work for its intended use doesn't mean that those side effects are going to skip you. So that's another thing that I really like about this is you're not creating side effects. The conference that I went to where we were learning about this and we were discussing this, 90% of people said that they got some kind of benefit. That's amazing. 9 out of 10 people, it's very rare that you get something that is FDA approved that gives you that kind of outcome, that kind of result. So again, this is, it's called ExoMind, 20-minute treatment, 6 sessions. It's comfortable. You're laying down on a massage table. You could be on a couch. You could be in a relaxed, comfortable chair. The way that I think is ideal is it's a nice, relaxed, quiet room. You're not rushed. Maybe you've got a nice weighted pillow over your eyes, or a weighted blanket. This is something, if you're interested, let me know, because if you're interested, I will bring this device from our sister clinic to Pacific Beach, and we can do a free trial so you can see what this feels like, see if it's something that works for you, and if it does, then you can start treatment. There's only a few contraindications, but for most everyone, this is working well. And one of the things I was very impressed with is there was a family on the stage as the doctor was explaining how this modality was so impactful for this family. One of the people on the stage was a new mother, and her 2-month-old was on the stage too. And she had baby blues. And the doctor had identified it. She felt that something was off. And after one treatment, the family thanked the doctor for getting her back. She didn't realize that she was in this fog, that she wasn't herself. Her family realized it, but the mother didn't realize it. And afterwards, the mother said she felt like a fog had lifted and she was back to herself. That was after one session. So she was going to complete the series, but I also like that because here's a mom. She could have been breastfeeding, and if she's taking medications, now she's not necessarily going to be able to breastfeed. But with this device, because there aren't side effects, she can get the treatment. The baby's safe, the mom is safe, and the family is happy. So, I very much respect people that really want to take care of their body and their brain. I respect folks. I understand why you would be skeptical of pharmaceuticals. And I feel like now that this modality is there, why don't you just go ahead and try this first for depression, for anxiety? At some point it could be insomnia. There could be other issues too. But since this is drug-free, and it's a transcranial magnetic stimulation, you might as well try it. Because if it works for you, that is awesome. That's something that's going to work really well. 6 sessions, and then you're doing maintenance. All right, that's enough for today, and we'll see each other soon. Thanks, bye-bye.